So our webinar today is introducing some powerful new reporting tools that we've been working on for the better part of 8 months now. Signals, and then also our assessments feature and some of the custom work we've done to build ways to measure some of the variables that are very specific to your programs and protocols. Really what we've done is tried to build the tool sets to finally start to make it easy to measure the outcomes at the individual level. More importantly, the outcomes across a cohort or practice, start to help clients or patients with adherence to the programs and the protocols, and a lot more that we can do with signals and assessments that I'm going to get into here in a second. But we're really, really excited to start rolling this out. The feedback from our beta customers has been amazing. So we'll get right into the details here. Our agenda, I'm going to start off with some introductions here in a second, and then I'm going to talk for a few minutes about signals, exactly what it does. We're going to talk about assessments. We're going to talk about custom tiles, and then I'm going to do a live demo just so you guys get a chance to see how this really works in practice. So we've got some slideware, but if you've been on any of our webinars, we always like to make sure that we show real live product in production so you can see exactly how this works. And then we've got a special offer at the end of the webinar for new and existing customers that can help you jump in on some of these features at a really, really nice price point. So let's start with introductions. For those who haven't met me, my name is Dave Korsunski. I'm the founder CEO here at Heads Up. And I've got two of my esteemed colleagues on the line. John and Alex, do you want to say hi and just give a quick introduction on your role here at the company?
I'm John Lemansky. I'm the Chief Medical Officer. My focus is internal medicine, but I've been with the team for quite a few years now. And so I'm excited to talk about this part of the product because I think it's going to be, quite applicable to providers going forward. So thanks for everybody who's joining us.
Thanks, Doc. Alex, you're up.
Hey, y'all. My name's Alex Smith. I'm on the product team here at Heads Up, and I have a specific focus on analytics tools. I have about 10 years of experience in the healthcare analytics world. So I'm really excited about some of the content that we've been building out in the system using signals. I think there's a lot of value here, so I'm really excited to share it with y'all.
Alex has been working on this behind the scenes for almost a year now. Slowly, we've been incubating this internally, making sure we get it just right. So a lot of this stuff you're about to see is his handiwork. So before we dive into the content today, I also want to introduce this book by one of our medical advisors. And here at Heads Up, we're very fortunate to have some very, very esteemed medical professionals on our advisory board. One of those is Dr. Molly Malou. And there are others like Dr. Helen Messier, Dr. Kevin Sprouse, who's on this webinar. And these are the medical professionals who help us build a lot of these very, very powerful reports. And they help us determine how to build these as concisely as possible. So we rely very heavily on our medical advisors for how we develop our product. And that is especially true with a lot of the reports that we're going to show you here. With Dr. Molly in particular, she's been instrumental in helping us build a lot of the reports for analyzing data from continuous glucose monitors. So these devices are incredible, but there's a very, very limited set of tools for practitioners who actually need to look at this data across dozens, hundreds, thousands of patients. So Dr. Molly and others have been really helpful in bringing all of this to life. This is her new book. And it's the first biohacking book written exclusively for women. So it just came out as a way for us to thank her for all the great work she's done. We wanted to promote the book here today. It really focuses on starting at the mitochondrial level. And it really goes into a lot of the advanced biohacks and how they may need to be tweaked a little bit for female biology, especially things like fasting and keto and other things that just work a little differently for the ladies out there. We're going to be giving away 15 copies of the book today, and 5 copies are going to be given away at each polling question. And the first 5 people who answer on the polling questions will get a copy of the book. My team is monitoring the Q&A, so they will be recording who jumps in first And for the second and third question, it's actually a little bit of medical expertise required. So that'll make it just a little more interesting to see who jumps in and gets the correct answer first. But congrats to Dr. Molly. Great book out there for the ladies who are interested in biohacking. More to come on that later. So the first polling question we're going to start with is just to learn a little bit about yourself. So, or for us to learn a little bit about you. Sorry, butchered that one. But we just want to get to know you guys a little bit about your practice. Have you tried Signals yet? Some of you guys have seen these reports. Some of you have helped us build these reports, like Brandy at 3 Health, Kevin at Podium Sports. So we'd just like to know, 1, have you tried it? It's in the app now, in case you haven't logged in. 2, tell us a bit about your business. 3, have you launched? Because we work with a lot of individuals who are about to launch. So just tell us where you're at business-wise, size of your practice, just so we can learn a little bit about our audience here today. And we'll be keeping track of those who chime in first, and first 5 get a copy of the book. A good amount of people have tried Signals so far. That's great. Looks like we've got cash pay and hybrid as the 2 most popular business models, and then 11 to 100 average practice size. So this all looks great. I'll give it a couple more seconds here and then we'll wrap it up. Thanks for everyone who chimed in. And for those on my team who are monitoring the responses, we'll get the books up. So let's talk about Signals. Why did we build this? And if you've been on Heads Up for a while, what you've noticed is that we have really, really good tools to capture very, very precise information from individual patients. And we have really, really powerful tools to look at the trends over time for individual patients. If you guys have been on the reports page and you've perhaps looked at a graph of someone's glucose levels or their heart rate variability or their deep sleep, we've got the reporting tools for individual patients. But the harder problem is, how do we start to build those types of reports for entire cohorts of patients, or an entire practice, or a very, very specific population? So the Signals product was developed really to provide capability that is already available in pretty much every other industry out there. And it's in the form of BI analytics tools. So these are very common tools in other industries, products like Tableau and products like Looker and other analytics tools can sit on top of a data set and make it very, very easy for you to ask specific questions from the data and pluck out very, very specific responses. And if we can deliver on that promise, it allows you as practitioners to get answers to things in a matter of seconds that would otherwise either be impossible to find because the tool set just doesn't exist, or it'll just take hours because you got to comb through individual reports. So some of the examples that we can do with Signals, and Alex, I'll get you to chime in here in a second just to speak a little bit more about what the product is. But with Signals, it allows us to finally deliver the promise to make it easier for you to track outcomes across the practice, especially in integrative and functional medicine, where it's often been difficult to measure how well a functional protocol works against the standard of care, would be one example. Or it's been really, really hard to figure out which patients in a program are doing really, really well and which ones aren't. And to be able to do that in real time, be able to measure the outcomes across an entire program. For example, if I have a diabetes program, can I make it easy to look at the average reduction in hemoglobin A1C or the average reduction in resting heart rate? So this lets us do outcomes analysis. It also lets us do very, very precise remote patient monitoring. For those who are in the payer system, we have reports that can make it very, very easy to surface the signals for remote patient monitoring billing. It makes it very easy to identify values that have gone out of range. And we often speak to practitioners who are using remote technology, and it's actually saved the patient's life because the individual measuring at home was able to find something where they didn't even have any symptoms, but the sensor data was able to pick it up In those examples, it happened just because the practitioner had asked the individual to measure or the device was included as part of the program. But now it's very, very easy for you to go in and program an out of range value. We're going to show examples from a continuous glucose monitor where you can go in and say, deliver a report anytime any of my patients' blood glucose levels goes above 180, or deliver a report where the person's weight has gone up or down by more than a certain percentage within a certain amount of time. So this lets you start to manage by exception. And whether you have dozens, hundreds, or thousands of people, you can instantly start to identify the individuals who have gone out of range. It's actually been a really hard thing to do in healthcare. Fetch good news. We have a lot of our health coaches that want us to surface good news in the data. And the good news keeps motivation going. So we can surface individuals whose numbers have improved in a positive direction and make it really easy to reach out and create positive feedback loops. Adherence, making sure that individuals are sticking to the program and following the steps that they're supposed to follow, and making it easy to figure out who's fallen off and maybe needs a phone call to get back on track. Leaderboards and challenges. We do a lot of these internally where we just make it fun. It could be steps or calories burned or a sleep scores or something where you want to get a cohort of people engaged in a fun and educational health challenge. Algorithm development, where you can come to us with a specific algorithm. So for example, we have some of our professional sports teams that need us to pull several different metrics from several different devices and run an algorithm against it. And based on the output there, deliver a specific recommendation to the coach. And then the sky's the limit where you can actually create your own. So with that said, Alex, maybe you could just elaborate on anything I've missed there or any specific examples that you'd want to share on signals. And then John, get your input here as well.
Yeah, thanks, Dave. I think Dave did a good job outlining the high level types of content that we've been creating in signals. And the main thing that I want to add to that is just the fact that this is a really powerful BI platform layered on top of all the data that's available in Heads Up. So what that means is we're building all this content out of the box, but these are just ideas and concepts. And we have now this very powerful tool to create tailor-made content that's relevant to you and your organization, relevant to the programs that you're running, to the data that you're interested in seeing. And we have a very quick development method for getting this content out the door. So we're really excited. Those who have used the tool so far have come back to us with a lot of suggestions for enhancements or suggestions for customizations. You know, I want to see something a little bit different for my organization. And now using this embedded BI platform, we're able to deliver on that kind of content really quickly. So I think it's a great value add for just about any organization. And the main thing to keep in mind as you're browsing through the content is that it is customizable.
Hey, John, you've worked inside of a lot of different health systems. You've worked with tons of different EHR systems,
Yep.
and you've seen some of the shortcomings with just being able to pull up a report to show me the vitamin D level of all my patients. Like a simple example like that, or even more specific, show me a report on all of my patients with a vitamin D level below X. You know, so these are like really, really simple queries inside of the data that are not always available to providers. So maybe you could just elaborate on what you've seen out there and then how you see this benefiting practitioners going forward.
Sure. Yeah. No, great points by both of you guys. You know, I think anybody who's used electronic medical records, they'll know that they're very good at gathering data. So you develop like a chart that basically has so much data that's repetitive, and that's all based for billing criteria. But I don't know if it necessarily enhances kind of patient care. I think what we've built is a way to streamline all that data to actually focus on the useful points that we want. And I think as a practitioner, one of the limitations to kind of, you know, increase your vertical and have more patients is being able to manage all that data. And so usually we want to see the ones that are outliers. And so we've developed a system basically that really focuses on those points. So it allows you to streamline how much time you're taking going through the data, and it really helps you provide better care, I think, because it picks it up much faster than you or I would. So I think it's not so much just that I really don't think it compares to the other kind of medical systems, because what we're trying to develop is something that helps you kind of guide patient care, but also streamline all that data. So it's a much more powerful tool. And then I think the most important point too is that at the end, as you mentioned, you can create your own. So not every practice is going to be the same. They're not all going to focus on the same things. So maybe you have a specialty in focusing on athletes, so you can really streamline the signals to focus on those markers that you're looking for. So it's a great tool. I'm really excited that we're finally able to launch it.
Thanks, John. We'll get into some specific algorithms that we've
Yep.
developed, just so people get an illustration of what's possible and get the creative ideas flowing. And then just to reiterate what Alex said, we have provided a subset of reports. So if you're a paying customer in Heads Up, you'll see a set number of reports. If you're on one of our trial plans, which means you haven't upgraded to a paid plan, you'll see a small subset of free reports just to see what's possible. But the most important thing is that you can come to us and tell us any kind of signal in the data that you're looking for, and we can crank it out for you very quickly. So it's fast, it's easy, it doesn't require engineering cycles on our time, so we can build these quickly and really precisely for your practice. So here's a couple examples I want to run through. Okay, I got 1,000 people on this system. I need to know which one's device connections have dropped off. Or I'm about to get on a consult with an individual patient. I need to make sure their device is connected. Now, even when you've got 100 people with a scale or a CGM or an Oura ring, or whatever the case might be. So even just being able to come in here and click on all of my patients with Oura, and you can see it'll show you exactly the status of each device. It'll show you if it's connected, it'll show you if it's disconnected, it'll show you if it's never been connected, it'll show you the last sync, and it will show you when it's first connected. So even that has really been a challenge in Heads Up so far. It's just making it easy for you or some staff member in the practice to make sure the devices are connected and they're feeding data into the system. This is even more important if you're doing remote patient monitoring. So a simple example, this is available in the system for everyone. So whether you're a premium customer or you're on the trial plan, you'll be able to go into Signals and test out the device and lab connections. And that's an easy way just to see if anyone has dropped off. The coach or the staff can just shoot a note, get the device to be reconnected. Simple example, but we've got 20 or 30 devices supported on the system now. So if it can get a little unwieldy to keep all of these connected, or if you're using one device, but it's mission critical for the patients, this will make it really easy to figure out if someone needs to reconnect. So that's a simple example. Another example is the one I just alluded to, where you may want to say, for example, show me all of the patients or clients on the system who have a vitamin D reading below 30. Or a vitamin D level above 90. So you can come in here and really set any threshold you want. When I show the live example, you'll see a slider, and you can just say, show me everyone below 30. And we'll show you exactly all the people who bubble up below 30. Or you can set your range. You can say my reference range is between, I don't know, 50 and 70. So show me everybody who's outside of that range. So simple queries on lab data that can help you identify people who maybe you want to run a report to show this for patients who have never had a test within the last 6 months. And that's a really easy way to get them a test and make sure that they've got an updated lab result on file. So here's an example of how Signals applies to the biomarkers in the system. John, Alex, any other comments on this one?
No.
All right, and then one more example. This is the out of range. These are the ones I'm really, really excited about. Again, to John's point, which is how do we manage the outliers? And how do we manage the people who have drifted out of range over the last week, month, whatever the case might be. So you can see this is a report for glucose, and I can easily determine here with the sliders, all the patients who have gone above or below a specific range. And this can just be checked once a day and automatically surface individuals who have gone outside of a specified threshold, and you can make the threshold whatever you want. We have a lot of our practitioners using continuous glucose monitoring, and you may want to flag readings above or below. a certain value. So this applies to anything, a heart rate variability reading, a blood pressure reading, a pulse ox reading, a weight reading, any type of vital sign you want to flag. Typically, this is for devices where they're being transmitted remotely, and you can just put these filters on and flag data. So, John, what comes up for me here is, going back into pandemic days where I could look at like anybody's blood oxygen who's gone below 90, anybody's body temperature who's gone above X. So there's use cases there to make it easy to flag these numbers. Before we had signals, you'd kind of have to go in and look at everybody individually, one by one, and see who went out of range, just kind of shortlisted. So thoughts for you from a provider perspective?
Yeah, I mean, a couple things. And, I think on the one hand, when you start tracking all the data from patients, you as a provider are responsible for it. Like legally, you're responsible for it, but also, I think ethically you are. So a lot of people who are using kind of continuous wearables in their practice and are not actually monitoring the outliers legally could be, actually liable. So I think as a practitioner, number one, you feel more comfortable because you're getting the data. So you can address things that are out of range a lot faster than you would. And then number two, also, I think as a practitioner, it allows you to kind of titrate whatever you're doing, whatever program you're using, in a much faster way than the typical, okay, I'll see you in 3 months, or I'll see you in 6 months, and we'll do labs at that point and see what happens. This, I think, is kind of the evolution of medicine, especially I think going forward, where you'll have a hybrid kind of model where you're not seeing every patient in the physical clinic, or some people don't even see their patients. But you can still do, a significant amount of medical care for people with this kind of data available.
Yeah, we've built these out of range reports. Alex, you can maybe speak to some of the biomarkers we've done it on: blood oxygen, glucose, any biomarker being collected remotely. We can build these out of range reports on.
Yeah, and when we get into the system, we can kind of show the breadth of the library that we've created already. But yeah, there's always going to be more coming. There's a long list of bringing all that data for tool that we've had to really bring the whole database front and center and allow you to see that data longitudinally.
Yeah, so if you're working with any type of metrics in your system, you can think, okay, what data is coming in where I want to surface the outliers? We have practitioners monitoring blood oxygen remotely for different programs, heart rate variability for athletes, for example, different types of use cases, whether it's wellness related or acute chronic care related. So we'll get into a live example here in a second, but we're going to go with polling question number 2 now. And we've got another 5 copies of Molly's book. And let me launch the second polling question here. Little trivia question there. How often does the Dexcom measure glucose on the sensor? First 5 people to get the right answer. People seem to know their stuff here. Wouldn't expect anything less. A few votes at 5. 5 minutes is the leader. Get another few seconds here. Going once. Going twice. 3 times. Gone. The answer is 5 minutes. So for those who jumped in, got the right answer, we will reach out to you after the webinar, get you a copy of Molly's book. Next, I want to talk about assessment. This is another big feature that went live. Actually, yesterday morning, we started launching it to select organizations. It's not available for everybody yet. I'll demo it here in a moment, but it will be, excuse me, in the next few days. Whenever we roll out a big feature, we like to just open it up for a few practices, get some feedback on it, let it sit out in the wild for a little bit. But we've done a really good job in Heads Up until now collecting objective data, sensor data, biometric data, lab results, all of that kind of thing. But we've also had a lot of requests to bring in more of the self-reported information. So those might be things like a subjective assessment, where you're asked to report how you feel on a scale of 1 to 5. It could be medical questionnaires, like the promise assessment, for example. Heads Up is being used now for a lot of medical research, clinical trials, where these assessments need to be collected periodically. It could be medical histories, intake forms. Dr. Kevin Sprouse is on the line. We built one for Dr. Kevin for him and his athletes that he sends out, and it asks them to answer 5 questions every week. Each question is a 1 to 10. The assessment computes a score. The score is promoted back to Dr. Sprouse in a signals report, as you can imagine, and he's able to quickly see how his athletes are recovering. So the assessments are ways to collect subjective and form-based data. Obviously, on the back end, you would then get a signal report to help color code and flag individual responses, who's completed it, who's hasn't. Has anyone reported a score that needs to go out of range? I think the best part of all of this, first of all, it's delivered right inside Heads Up. So you can see this is the perceived stress score, and it's an industry standard stress assessment. And you answer a number of questions, and they're subjective answers. These are industry standard assessments we can deliver, or we can deliver whatever types of forms and assessments you're using today. The sky is the limit. All you would need to do is get in touch with our customer success team. We build these on the back end. I'll show you exactly how they work inside the system in a moment. The patients or clients can complete these either on the web app, or they can use it right from the Heads Up mobile app. So it's mobile friendly and can be done on the go. Most importantly, all of the answers for these assessments are stored inside of the database. So it's all structured data. It's not a PDF file. You can generate a PDF file, but the answers to every questions, the timestamps, the computed scores, they're all stored. That means that we can run signals reports against the answers. And it means that we can correlate something like a perceived stress score, and then look at someone's heart rate variability from an Oura ring or Garmin, for example. So the benefit to having these inside the system is that we can start to cross-reference it with other biometric data. So, John, thoughts on just what's possible when you can take this information and then have it right next to the biometric data, labs, biofeedback, that type of thing.
Yeah, again, I mean, I think it goes to the customization of your practice and how you're treating patients. So, you know, in my kind of practice, I'll have people on different kind of protocols depending on what they're focused on. It helps me to reassess kind of, is the program working? Are they having success with it? So it's a good way to check in without actually physically checking in with patients or clients. And then, you know, especially if you're a cash pay kind of service, a lot of times you still have to kind of show that you're producing something for the client. And maybe weight is the end metric, but for a lot of people that may not be the case. So you can show over time, look, when you started this program, this is kind of what your assessment was. As we went along, you can see the progress. So it helps kind of, I think, refresh the memory of both the practitioner, but also the clients. Plus, if you have a big practice, and let's say you have a lot of health coaches, you know, under you, or practitioners under you, but you still want to review those patients, it allows you to really kind of streamline it, so you can get the feedback that you want. You know.
Yeah, and we actually we do have organizations who aren't even using devices in their program. You know, it's all self-reported data. So that also opens up new possibilities for how you want to use the dashboard. A lot of clients get overwhelmed with the biometric data. Okay, well, they don't need to see it at all, as long as they are reporting subjective information like that is a different way to use it. So, Alex, you've built a lot of these. Any other comments just on what's possible when you kind of have all the data under one roof?
Yeah, I mean, I'm glad we are talking about these two features right back to back, because they dovetail together. You know, we're getting all this structured data into the system, and the assessments provide another way to get a lot of structured data into the system. So, you know, once again, Heads Up is bringing data from wearable devices, from manually entered tiles, manually entered health data, from health systems, and now also from these assessments. And it provides a lot of value to be able to visualize how the values from an assessment might be affected by the values from, you know, your Oura ring. Is your stress score getting better when you're sleeping better? We can answer that at a cohort level using signals.
Let's take a few questions here if we have any. Renee's in Reno going skiing after this meeting. Yeah, thanks, Renee. Didn't need to hear that.
That's awesome.
Can you integrate an approach like Outcome MD? We're a little bit familiar with them, but I'd have to get back to you on that. Can you set standard deviations, peaks, and time and range? Alex, yeah, we're going to get into that in a second. All of those are available, and we have a live demo on that coming in a minute. So just a couple examples of what assessments look like inside Heads Up. As the practice, you'll be able to build out your library of assessments, and we'll do this for you. You'll be able to assign assessments. You'll be able to track the completion status for each individual. And then the signals reports are really kind of what take to the next level on the back end. Again, we've got a live demo coming here. This is our third and final polling question. And we'll give away the final 5 copies here. We've got another IQ test here. There we go. Which of the following peptides is commonly used to stimulate growth hormone? Tight race. Polling question going once. Polling question going twice. Polling question gone. CJC 595 is the correct response. The last thing I want to mention is very similar to assessments, but we also have the ability to develop custom tiles. So if you've seen the Heads Up dashboard, we can certainly display biometrics, blood glucose, weight, body fat, hyperbaric oxygen, sauna, cryotherapy, anything you'd want to have an individual self-report. But we now have the ability to develop custom tiles specific to some of the things that are maybe a bit more bespoke to your practice. So it could be a tile that asks someone to just simply report when they've engaged in a specific behavior. For example, prescribing 10 minutes of morning sun exposure. We're working with a lot of organizations that are doing research. And so we have custom tiles where you can have someone start when they began an intervention on the tile and stop when they ended the intervention. That way you can collect data from hundreds of people, regardless of when they enrolled in the program, and look at the outcomes based on other data. We can really build these to your specification. So if there's data you want people to self-report, but you haven't seen a good way for them to report it, we can build these custom tiles for you, much like assessments. They work on web and mobile. And much like assessments, we then build the signals reports on the back end so that you can look at the results across a cohort. You can look at adherence. Hey, I've got 20 people who are supposed to be measuring every 3 days. Which ones didn't measure? So the custom tiles, much like the assessments, just tell us what it is that we need people to self-report. We'll build the tile for you. We'll deploy the tile on web and mobile, and then we'll create the signals assessment for you on the back end. So in the interest of time, what I'd like to do is just cut over to a quick demo here. This will just kind of bring it home live. And you know how it is, live demos online, no pressure. Here we go. So I'm going to log into one of my test organizations here. And let's start with signals. So everyone who's got an account, whether you're a premium or on a trial plan, you'll now see the signals link here. And let's run through a few specific examples, some of the ones I've touched on. This will be live data now. So I want to look at all of my patients or clients, and I want to look at the connection status for Oura as an example, or the connection status for Dexcom, but I'm going to pick Oura. Let's see here, it's still loading.
So Dave, one thing you can do here is just search in that bottom right on the right side in the all connections details box. A lot of components in your dashboards are going to have that search box, and it searches everything available there. So if you type Oura in there, you'll see the Oura status for each of your clients.
Go. All right, here's my clients with Oura connected. Here's my 3 that have never connected Oura. Here's when they last synced. Here's when they first connected. So this can be filtered for any device on the system. If you want to check the status for glucose, Libre, Garmin, anything, any of the supported devices on the system, so I can see how many clients, how many have it connected. Really easy way just to make sure that there's data feeding. So that was one of the first examples that I mentioned. The other one is, let's look at a custom tile. So I'm going to look at the dashboard for an individual. And on this dashboard, we've created a custom tile. And this custom tile is just a reporting of subjective metrics. And it's the daily wellness score. So I may ask an individual to complete this. Again, it can be done on web and mobile. You answer a bunch of questions on a 1 to 5 scale, and it computes the score. And then I want to start looking at the entire cohort and starting to look at some of the results. So then I can start to see the data feeding in on the signals assessment. And we can do things like color code values that are within a specific score. Let's see, let's go last week. I think I did the right assessment. Let me come back to this one. Daily wellness score. Refresh. All right, I'll have to come back to this one in a second. Let's jump ahead to CGM, as there was a specific question on that. So on the continuous glucose monitors, again, we're having a lot of interest from practitioners. And there's a lot of patients or clients using the CGMs. And there's great ways out there for individuals to look at CGM data. But how do I start to look at this for my entire practice? So I've got 2 clients with a glucose monitor connected. It could be Dexcom, or it could be LibreView, either one. And you can see my cohort over the last month has averaged 93. The standard deviation for the cohort is 16. The time in range is 87%. And then the spikes above 140 are 1.3%. Now we can customize these numbers for your practice. If you want to see spikes above 120, spikes above 160. And here's how the color coding works as well. So if I've got, there's only 2 in here, but you could imagine 10, 20, or 30 different patients. Maybe I want to sort all patients by the standard deviation or sort based on time in range. So you'll automatically be able to see individual rankings, and then you'll see the color codings as well. So anything in yellow or red is going to be based on these thresholds. So there was a question about looking at this data for CGM, and then you may say, okay, someone is coming up in red. I may want to do a drill down into that individual patient. So then you can go into the CGM drill down, and we can develop these for any metric. It doesn't have to be glucose. It can be blood pressure. It can be weight. It can be any of the metrics we support on the system. So now I'm going to drill down on an individual person, CGM SAM. And I'm going to look over the last month, and we want to break it down week by week. And so you can see that the standard deviation this week from Jan 16 to Jan 22 was pretty high at 31. But the rest of the time, the other 3 weeks, their standard deviation actually looks pretty good. And you can see in that same week, the time in range was very low and the number of readings above 140. So it may just be that this was a week where someone was not adhering to a program. I've had weeks where my sensor's just been whacked out and I ran out of calibration strips on my glucometer. So this starts to break it down and give you a report for an individual. It gives you some trending to see when exactly did values start to go out of range. So you've got the individual drill down. There's a couple of those I wanted to show in here. The good news. So a lot of our practitioners have said, hey, can you give us reports that fetch good news in the data? So working with some of our health coaches, they've said, I just want to see over the past week whose average has improved, or whose standard deviation has improved, or whose time in range has improved. So we can build any kind of good news filters you want inside the data. This will take a second to load, but for anyone whose average has increased, I may just want to shoot them a little note. And there's only a couple clients in here, so there's really no data populating, but this would show you a ranking of all clients who have seen a positive increase in glucose week over week, or a positive increase in standard deviation. And you'd see the individual here, and you'd see how much they've improved, and you can shoot a positive note of reinforcement in there. I'll show a couple other examples. This is the remote patient monitoring report for any practices that are in the payer system. And this is where you may want to start flagging device connections for the 99453 code. You may want to make sure that people are hitting the minimum eligible reading per month. And we can also start to track the amount of time spent reviewing the data, including time spent outside the system. So these can be custom built and exported in a format that works for your billing team. See if there's any other examples I wanted to touch on here.
Dave, when you want to circle back to the daily wellness assessment, I can demo that one. I've got it up right now.
Okay. Yeah, I'll kick it over to you because I may not have any sample data in there. So these are all the different types of assessments that you can build if you have patients who need to self-report symptoms. So you can see that I've got people, we can put any symptoms on a user dashboard. Let me just show you how that works. So if I have patients on semaglutide, for example, and they may need to report things like nausea or fatigue. So you can see that this individual reported a 9 out of 10 on the nausea scale. Maybe it's 6 out of 10 today. And so then what the signal report can do is then say, okay, show me all of the patients who reported greater than 9 out of 10 or 7 out of 10 or 8 out of 10. This helps you, again, manage by exception. So you can see how it starts with anything you need an individual to self-report, whether it's an assessment, a symptom, a custom tile, whatever the case might be, and then how it pulls through, the types of color coding that we can do. This can all be custom developed for your practice. The goal, again, is A, to help you be proactive and find things quicker. B, to help you calibrate protocols in real time, because as Dr. Lemansky said, you can now do this a lot faster. You don't have to wait 6 months for fresh labs. You can get real-time data coming in and calibrate in real time. You can start to measure the outcome. So there's lots of ways this pulls together, and it's really kind of all been completed by this last module that we've layered in, which is the signals. So Alex, just to close the loop here, maybe you can do the assessments that I couldn't load for some reason. You want to share your screen?
Yeah, so I'm going to share my screen, which is in our demo organization. So we've been using this one a little bit. So our daily wellness assessment is just the tile that Dave showed. It's a 5-question survey asking how you're feeling. And then you can see all of the tabular results for that. So this is a great example of a custom survey, 5 questions, all numeric results. And what you get is a total score. And the cool thing here is the fetching good news or bad news, right? You can see who's feeling good subjectively or bad, and that's going to be highlighted accordingly. So when people are answering 1s or 2s in their 1 to 5 scale of how they're feeling, that's going to be highlighted and brought up to the top. And you're able to also do all the sorting and filtering that you need to, so you can kind of see who's doing badly and when, and who's doing well and when. And then we also have summary components as well, so you can see people's weekly averages over time and how many times they're filling out the survey. So a lot of cool stuff here. And I would always encourage you to use these filters. One of the best things that you can do with the filters that's a common use case is changing the time range. So this is just looking at all the data from the last year, but if you want to extend that or cut it down to just the last few days, this is all parameterized. So you can really play with all of these filters and say, show me just the bad scores from the last year, for example. Run it and it executes right away on the database.
Thanks, Alex. If you can stop, I want to show one more example I forgot to show, and that's the out of range stuff. I think this is also really helpful. And I'll use glucose as the example, but apply this to anything, right? Blood pressure, blood oxygen, weight, whatever the case might be. So let's just look at CGM readings. And I want to filter based on out of range low, out of range high. And so as soon as this loads, you'll see that it's actually completely parameterized. So you can say high values is anything above 160. Maybe I want to be a little bit more aggressive and say, show me everybody above 150. And you can see it as soon as I apply, it'll flag everybody who's got a reading above 150. Or maybe I just want to look at readings above, let's say 180, for example. So this is just like click of the mouse stuff we can do and filter. And there's a couple readings there. So this lets you, in a matter of just a couple taps, really manage by exception, whether it's good news or bad news. You can come in here and find this information quickly. This has really been time consuming to do in Heads Up previously. In a lot of other systems, it's just simply not possible. So some live examples of what we can do. And then I'll just close with an offer that we're giving out to announce these new features and make it available to our customers. If you want to get started with us and get signals rolling in your organization, get assessments rolling, get custom tiles, we have 50% off the first 6 months for your subscription. If you're an existing customer, 50% off custom development for any of these reports. Sometimes they take 30 minutes, sometimes they take 3 hours. But the cost of the custom development will be 50% off. And then if you are bumping into the next tier, it'll be 50% off the next tier for 6 months. If you're interested, just shoot us an email, support@headsuphealth.com, mention the webinar. Fine print, you got to upgrade by the end of the month, and it's on 1-year subscriptions. But a great way to get in there, get started with these features. It's a really, really aggressive offer by giving 50% off for 6 months. So feel free to take advantage of that. We'd love to hear from you. We'd happy just to arrange a demo or gather some requirements for you on what you'd like to see from signals in your practice. So that's all I've got. I'm just going to pick up in the Q&A here and see if I missed anything. Sybil's asking Libre in Canada and UK. Yes, we do, Sybil. With Dexcom, it's the United States only at present. I do know they have APIs in other countries. We just haven't gotten access to it yet. Full cognitive assessment from Dr. BJ. We'd need to see the assessment, Dr. BJ, so please get in touch with us. And then the cost for custom development, it's just time-based. You know, Alex will look at your assessment and we'll give you a quote. It's based on the number of hours that it takes us to build it, and it's a one-time thing. So a couple hours typically at the max to build anything, you know, a few $100s to get it going, then it's yours forever inside the system. And then we'll see if there's anything in the chat here. I think that's it. All right. So that's all we have for everybody today. We hope you log in and try all this stuff out. And if you want to get anything in custom tile signals or assessments that's not in your portal today, reach out to us. We'll be happy to build it for you. So thank you to Alex and for all your amazing work building all of this stuff, and to the rest of our engineering team, Rohan and Steven and Song and everybody else who worked so tirelessly to build all of this stuff. I just want to acknowledge all of the work that goes into building this really, really intricate analytics. It's hard and it's detailed. So I just want to thank my team and then acknowledge Dr. Lemansky for your support as always. And have a great weekend, everybody. I'm gonna sign off now.
Thanks, everybody.